Hello and thank you for watching. My name is Laura McGahey and I'm the Executive Director of Sláintecare at the Department of Health. Today I'd like to tell you about Sláintecare and how it will improve Ireland's health and social care services and what we've been doing over the course of 2020 to implement this important reform programme. Firstly, some background. Sláintecare is the cross-government party plan to transform Ireland's health and social care services. It is the roadmap for building an excellent, accessible health and social care service for the growing needs of the Irish people over the coming years. It is based on 5 fundamental principles. Firstly, keeping people well and preventing ill health. Secondly, providing as much care as safely possible near to people's own homes and keeping people out of hospital. Thirdly, improving the capacity of our health service in order to meet growing needs and Sláintecare waiting time targets. Fourthly, making better use of technology and modernising how our health services are delivered. And finally, making sure that safe care is delivered at low or no cost. Ultimately, Sláintecare is about delivering the right care in the right place at the right time by the right team at low or no cost. 2019 was the first full year of Sláintecare implementation and much was achieved. In 2019, we had agreement on the geographies for a new regional-based structure for the health service to enable the planning and delivery of care based on the actual needs of local populations. A new Sláintecare contract for consultants was agreed so that new consultants will only deliver public work in public hospitals from next year onwards, thereby making the system fairer. And a new GP contract was formalised, which expands the work GPs do to manage chronic conditions such as diabetes or COPD in the community. This is helping to ease the pressure on our acute hospitals and provides proactive care for people living with chronic conditions. Turning now to 2020, as we all know, this year has been dominated by COVID-19, but the pandemic has demonstrated not just the commitment and tireless dedication of our health and social care workforce, but it has also demonstrated the willingness and eagerness of our health and social care staff and systems to innovate and adapt for the benefit of patients. It has also shown the value of community workers and volunteers who provide an essential support network to patients and service users of our health and social care system. Many of the changes we have seen in the health service this year have embodied the core Sláintecare principle of delivering the right care in the right place at the right time. Key to this approach is developing more services that are shaped around the needs of the patient rather than the other way around. For example, we have seen a huge increase in telehealth access to GP services, which allows people to speak with their GP over the phone or video conference much more easily. And we have seen the rapid deployment of e-health solutions, from speedy prescription delivery to pharmacies to the delivery of appointments such as physiotherapy sessions or exercise programs online. Through the €20 million Sláintecare Integration Fund, we've put in place more than 100 innovative projects across the country, led by partners such as hospitals, hospital groups, community organisations and NGOs, primary care centres and universities, among many others, each working to improve the health and social care service and provide care in the right place at the right time. Learning from these innovations, we're now rolling out best practice right across the country. We've also worked to improve our digital health infrastructure and our use of technology by expanding the secure health mail platform. Since April, this has allowed GPs and pharmacies to exchange almost 20,000 prescription messages per day, thereby significantly improving efficiencies for them and for patients. Attend Anywhere, a video conference appointment system, which has been rolled out at a national level, has resulted in 30% of return outpatient appointments now being delivered remotely. Here are just a few examples of Sláintecare in action around the country and the people that are working on the front line to make the Sláintecare vision a reality.
Hello, my name is Pauline Ackerman and I want to tell you about Pathfinder. Pathfinder is a service run by Beaumont Hospital and the National Ambulance Service, serving the Beaumont Hospital catchment area here in North Dublin. And it's delivered by a dedicated team of advanced paramedics, occupational therapists and physiotherapists, utilising a whole network of community health resources. This service responds to 999 112 calls by elderly patients, and it aims to change the current model of automatic transport to the emergency department to one where a person is treated at the scene. The service aims to keep older persons at home where they can be managed safely and avoid unnecessary presentation to the emergency department. It also relieves pressure within the ED and supports increased capacity in the ED to care for other patients. And the positive feedback from patients and families confirm that this is the kind of service that they want in this time of hospital congestion and COVID-19.
My name is Dr. Susan Coote and I'm the project lead for the Active Neuro project based at MS Ireland. The aim of our project is to employ an integrated care approach to delivering health-promoting physical activity programmes for people with neurological conditions living in the community. There are many known benefits of exercise for this population. These include a reduction in symptom severity, an improvement in quality of life and participation, and a reduction in healthcare service utilisation. Since April, we've had over 150 participants in our 10-week online programmes. The high number of referrals confirms the need for this service, and satisfaction survey data is extremely positive. Because we're online, the barriers of transport and accessibility are reduced, and this is supported by attendance and adherence outputs that are much higher than our in-person classes. 72% of our participants report an improvement in symptoms, and GP service utilisation is halved for those taking part.
Hello, my name is Professor May Cleary and I am the project lead for the Sláintecare funded virtual elective orthopaedic clinic project. Our project is aimed at addressing the orthopaedic elective waitlist at University Hospital Waterford through the use of a custom-made, secure and GDPR compliant mobile application. We will bring orthopaedic specialists and general practitioners closer together. Using this app, GPs will refer their clients to an orthopaedic specialist directly and they'll receive feedback within 48 hours with a recommended course of action. This can act as a rapid telemedicine-like resource, providing access to specialist opinion to help GPs deliver non-urgent care in the community, convenient for patients and avoiding the acute hospital setting. This should reduce referrals to the orthopaedic outpatients, as GPs will get almost instant feedback as to what treatment may be required, such as referral to physiotherapy, etc., thereby leading to reduced wait times for patients, hospital avoidance, increased patient satisfaction and better service delivery for the right patient at the right time. Thank you.
Hi, I'm Tyglahan and I am a GP. Our Sláintecare funded project, Inclusion Health Primary Care, is run by CHO7 in partnership with Thomas Court Medical Practice and DePaul, Ireland. Many people living in homeless accommodation have complex medical needs. They live with chronic conditions and present with chaotic lifestyles. Needs often go unmet. This project allows doctors, nurses and support staff to positively support clients take control of their healthcare. Through outreach clinics, we shift the focus of care from the emergency to the community setting, and it really works. We receive great feedback from our patients. The benefits of this approach are many: preventing escalation of medical conditions by early intervention. There's a behavioural shift by empowering our patients with support and respect, and there's a reduced reliance on acute services with less attendances in A&E and fewer prolonged hospital admissions.
Hello, my name is Michelle Kearns and I'm the CIO of CareDoc and the project lead of our Sláintecare project, SMILE. And SMILE is delivered in conjunction with Dundalk IT and Trinity College Dublin. The objectives of SMILE are to keep patients well and at home in the community, to empower patients to self-manage their own care and to avoid unscheduled hospital visits or GP visits. This has been very important throughout COVID because patients haven't wanted to go to hospital or to their GP unnecessarily, but they also needed that support and that clinical guidance. So in conjunction with the digital platform ProAct, our nurses have supported the patients and have taught them how to self-manage, to know more about their condition, to know more about their medication, to manage their medication correctly. And to date, the results have been fantastic. We have had over 50% of our reduction of unscheduled care cases for our patients, and we have had a huge rise in medication management and compliance. And we look forward to continuing on with the project. Thank you very much.
Those are just some of the Sláintecare projects across Ireland that are delivering incredible results and looking at the reform of our health and social care service for the benefit of patients. I want to take this opportunity to thank all our Integration Fund partners for their hard work and dedication this year. 2020 has been a challenging year in which to innovate and create change, but you've all shown what can be done even in the midst of a crisis. Now, as we look forward towards 2021, we are in a better position than ever to implement Sláintecare at pace. Budget 2021 saw a very large and very welcome increase to the health budget, which includes €1.353 billion specifically to fund Sláintecare priorities. Now we can progress our goal of delivering more community-based care with the establishment of 96 community healthcare networks to serve local populations of approximately 50,000. These networks will support people to live more independently in their community by coordinating and integrating services with GPs, health and social care professionals empowered at the local level. These will include integrated programmes for older people, supported by a large increase in home help hours, and specialist hubs for chronic disease management. It also includes providing integrated services for people living with a disability. We will also open more than 1,000 extra hospital beds and create new intensive care capacity. We will invest in up to 15 healthy communities around the country to provide extra services for people who need them most. Through our Healthy Ireland partners, we will work to support healthier living through our Healthy Homes, Healthy Cities, Healthy Campuses and Healthy Workplace initiatives. This focus will enhance the resilience of the health service in the face of COVID-19, but it will also expand and reform the health service for the future in line with Sláintecare objectives. Finally, I would like to say thank you for listening and for your interest and support of Sláintecare reforms. We aim to make Ireland's health and social care system better for everyone with your support. Thank you again.